In 2014 and 2015, there was a special group that worked together for a year and a half to come up with the best form of healthcare financing in Ukraine. Right now, Ukraine has a Samashko system that was left over from the Soviet Union, and for 25 years, nothing has changed. What happens is there's budgetary funds that are taken from the taxes. A small amount of the budget is divided across the whole country, and basically it pays for the existence of hospitals and workers inside the hospitals, but it doesn't actually pay for any medical services. It pays for the infrastructure and the very low salaries of the medical workers, but there's no services that are guaranteed or provided. It's not results-oriented, and there really isn't any prophylaxis, any prophylactic medicine, any preventative medicine. And most people at this point, because of the small amount of budget that is spread out over the entire infrastructure of the entire country, where there is a redundancy of hospitals and medical facilities as well as a redundancy of healthcare workers. In Ukraine, there's about 2 times as many hospital beds per 10,000 population and 1.5 times as many healthcare workers per population compared to the rest of Europe. Because this very minimal financing really doesn't get down to the patients end up paying for everything else. They pay the doctor for the services. They pay for all of the disposable materials if they have to have any in the hospital. They pay for all their own medicines, whether it's inpatient or outpatient treatment. And 92% of Ukrainians are worried that they'll be financially ruined if they become sick. So they don't go to doctors. They self-medicate watching commercials on television. And unfortunately, about 50% of the medicines that are advertised on television in Ukraine don't even have any pharmaceutical effect. They're just some sort of supplements. Many people wait until the last minute to see their doctors, so diseases are found very late stage. And Ukrainians live on average between 7 and 10 years less than our European neighbors. They also have a much lower quality of life. There are many more heart attacks and strokes at early ages, between the ages of 30 and 40, rather than in their 70s and 80s, the way it is in most other countries. So because the system really isn't working, we need to come up with a new way of providing health care. And one of those ways is to change the way that we finance things, that instead of paying for the existence of a hospital, we actually will be paying for services provided, and it'll be results oriented. In other words, we will look at what the results are, and the financing will go to those doctors and those hospitals that provide the best services, that have the best results. The new healthcare laws are simply the method in which we'll be able to do this. So for a year and a half, a group of experts from all over the world, including from Ukraine, worked on a new financial system for financing healthcare in Ukraine. We went through parliamentary hearings. We had a collegium of the Ministry of Health. We also had hearings at the Cabinet of Ministers. This all happened before we even came into the ministry last summer. Last summer, we took this plan and we created a concept for the change of medical financing in Ukraine. We presented it from the lowest level, family doctors out in the regions, all the way up to the Parliamentary Committee on Healthcare, the Cabinet of Ministers, and we finally voted in this concept at the end of November of 2016. In this concept, it's a prerequisite for implementing a new financing scheme is to have a legal structure, to have new laws that allow us to change the way the budget is divided and paid out for healthcare. Instead of paying for facilities, we now will be paying for services. So the structure is this: primary care, emergency care, and palliative care are 100% guaranteed. Each person who lives in Ukraine has those services guaranteed at no cost. To access the system, you need to choose your family doctor or your pediatrician or your general practice doctor and sign up with them. There's an electronic medical system. There's an electronic registry of doctors, an electronic registry of patients. You sign in to your doctor, and that puts you into the system. You don't have to look for a policy. You don't have to sign some kind of forms. You just come to your doctor and say, you're going to be my doctor from now on. I'm now in the system. At that point, all the primary healthcare services will be provided for you and the the financing will happen as a capitation per patient. The doctor will receive a certain amount of money per patient every month to take care of that patient. On the emergency care level, you pay nothing. The services are paid for from the moment you call the ambulance until your treatment is completed. If there ends up being hospitalization, that will be paid for by the National Health Insurance. And palliative care, the services provided for palliative care will be paid for by the National Health Insurance. As I'm saying National Health Insurance, you see that we need to create a new structure called the National Health Insurance because it doesn't exist in Ukraine. It's called Nationalna Sluzhba Zdоров'я, or the National Health Service. And what it will do is it will be the main distributor of financing into the healthcare system. The National Health Service will sign contracts with doctors, specifically doctors if they have their own practice, or with the medical facility, and they will pay directly for services to that doctor or to the medical facility without all of the in-between levels of the oblast level and the rayon level and the city level. So there's a lot of bureaucracy that's being cut out of the system so that we don't have a redundancy and everyone takes their cut of 10% or however much it is. And by the time you get to where the doctor is and where the services are supposed to be provided, there's not enough for the patient. We're cutting all of that out, and it's going to go directly from the National Health Service to the medical facility. And then when it comes to hospitalization and specialized care, there likely will be some co-payment necessary by the patients because Ukraine at this time economically can't afford to pay 100% of all services. They will be set fees that will be transparent. Everyone will know what those fees are. The government National Health Insurance will be able to pay for as much as it possibly can, and there may be some co-pays associated with some of the services provided in specialized care and in hospitalization. The new system doesn't require that we stop programs that we currently have in Ukraine. We spoke last time about national procurement of medicines. That will continue, and those medicines will continue to be provided at no cost to patients who are hospitalized or who need care for cancer treatment, hepatitis treatment, HIV treatment, tuberculosis treatment. Those programs aren't stopping. They will continue, as will new programs on preventative medicine, where we have a new national public health center, which will be providing new programs for prevention of cancer, prevention of heart disease, prevention of transmission of tuberculosis, HIV, and hepatitis C. Those programs are separate from the services provided to each and every one of our patients. Public health will continue. Immunization programs will continue. Procurement of medicines for patients so that they don't have to pay for them themselves will continue. Last month, actually in April, we started a reimbursement program for cardiovascular disease, type 2 diabetes, and bronchial asthma. Patients who receive a prescription from their primary care doctor go to a pharmacy and they receive the medicine at no cost or with a small co-payment if it's a little bit more expensive medicine. And now they're able to have ambulatory treatment and they're able to afford the medicines that they couldn't afford. We're even looking at how successful that single program has been compared to 2016, month of 2016, April of 2016, and comparing it to April of 2017, there's been an increase of use of those medicines by 62%. And there also has been a decrease in the price of those medicines by 23%. Because the reimbursement program, to join the reimbursement program as a manufacturer, you need to get your price within a certain range. And the manufacturers have dropped their prices to get into the range because they understand that reimbursement is the future of pharmaceutical in Ukraine. More and more medicines will be provided for by a reimbursement program that will be happening once again through our national health insurance, the National Health Service. So what did we do? We had 4 laws that changed the way that medical financing occurs. We submitted them into Parliament. They were registered. And when they came up to a vote to even be just included on the agenda, Parliament couldn't drum up enough votes to even talk about it. And the saddest thing is it isn't that they voted against it because they have a problem with the laws. They just didn't vote. they were either not present or they didn't vote. After that happened, there was a huge wave of discontent among civil society that Parliament doesn't even care enough to vote about these laws. It forced the formation of a working group within Parliament to go over the laws and to take a look at them and see if there's anything that we need to change in them to make them more friendly for voting into Parliament. After that working group finished working, there were 22 members of Parliament, and then there were 3 representatives from the Ministry of Health. It culminated in a National Reforms Council meeting with the President and all of the representatives. The Cabinet of Ministers has supported the reforms from the very beginning. The Prime Minister has been behind these reforms from the very beginning. It was voted on and as a concept in the Cabinet of Ministers last year. The Cabinet of Ministers has always, and the Prime Minister Groisman have always been behind this. We just last week had the National Reforms Council, where the President has now taken on healthcare as well as a priority. And at the National Reforms Council, he requested that Parliament vote these laws in by the end of this parliamentary session. That's something that we have been saying from the Ministry, and the Cabinet of Ministers has been asking the Parliament to do. But now I think with the presidential administration and the President on board, it'll be pretty difficult for Parliament not to follow through on these plans. The second thing is the Parliamentary Committee working group that worked for 2 weeks. They sat down, and at first all 22 members were there. And then as time went on, the people who weren't that interested in doing work kind of fell apart. But over that 2-week period of time, the really core 10 people worked on the laws. Instead of having 4 laws, we now only have 2. One major law that talks about the change in the financing of healthcare. It provides extra guarantees for the soldiers who've been disabled or injured in the war in Eastern Ukraine, so that they have full coverage of healthcare for the rest of their lives. And there's also a provision in there that requires Ukraine to start implementing use of international standards of care rather than separate Ukrainian medical protocols, so that we use best evidence-based medicine. It increases the quality of providing health care. And then that is all in one package. Those were 3 separate laws in the past. And then the second law is changes to the budget code, because we were paying for health care in a different manner. Instead of paying a subvention or paying money to each of the regions to provide payment for the infrastructure, we're actually going to be paying for services. So we had to change the budget code. So now there are 2 laws. The anticipation is that tomorrow, these laws, Tuesday, June 6th, these laws will be put onto the agenda for voting. On Wednesday, they will be sent to committee. And on Thursday, they will be voted in the first reading. There are 2 readings when we have votes. And after voting in for the first reading, it will also be voted upon to have the second reading done in an expedited manner. There's a week break. And then when we come back after the week break, the idea is on June 22nd that the laws will be voted on in their final stage. And that by June 22nd, we'll have a new financial system of healthcare in Ukraine, which is frankly a revolution when it comes to healthcare here, because we will now allow physicians and nurses and those that practice that help patients to make decent wage, because until now they've been paid a very low amount of money. They'll now be paid in the primary care level by the number of patients they have, rather than just because they're there when they show up to work. So those doctors that have more patients, those higher quality doctors that care more about the patients and see more of them, will have a higher wage. And then those hospitals and those facilities that provide better services, that have better results, will also be the ones that will be financed. We also are optimizing the hospital network in Ukraine. At this time, we have 800 regional hospitals that are all of very low quality. We've started reorganizing them into something called hospital districts. In each district, the local government is choosing which hospitals will be the emergency hospitals say like a trauma 3-level trauma center, where they'll be providing 24 hours a day, 7 days a week services for all patients who have any kind of emergencies, as well as any surgeries that need to be done. And then there'll be several hospitals that are for planned surgeries. There'll be ambulatory centers where patients see their primary care doctors, polyclinics where they see specialized care. Diagnostic centers will be either included or separate from these rehabilitation centers, addiction treatment centers, long-term care centers, and palliative care or hospices. Many of those last 5 that I said don't even exist in Ukraine at this time. So what we'd like to do is take this very infrastructure-heavy system, optimize it so that we invest into those hospitals that are in a good location for the patients to be able to get to, and concentrate our medical personnel as well as the medical equipment into those hospitals to make them really high-end hospitals, and then use the facilities which right now are barely existing and don't provide any care for patients, change those hospitals or those medical facilities into other kinds of medical facilities that really are lacking in Ukraine, such as rehabilitation centers and hospices. So nobody's closing down any hospital, reprofiling them to provide different types of services. There's a very big infrastructure in Ukraine. As I said, it's overly infrastructure with a lot of buildings and a lot of medical personnel, and they're not really being used very effectively. And we think that it's better for both the patients, and it's also better for the professionals themselves to be able to work in a facility where they're able to provide the care, they have the equipment around them that they need, and also the personnel around them to be able to provide the best care for their patients.